Welcome to the Got Invention Show. I'm your host, Brian Freed, and our guest today is Dale Miller. He's from the Chin-Up Strip Company, and he invented Chin-Up Strips. Welcome to the show, Dale.
Good evening, Brian.
I had a chance to learn about you and your background, and I had a chance to take a look at your website. Very interesting guy and product. Dale, why don't you start off by telling us who you are and where you're from and what do you do for a living?
I'm obviously Dale Miller, and I practiced law in central Wisconsin for 29 years, and then moved to Georgia, Atlanta, to proceed with the invention idea that I developed, the chin-up strip, simply because I had to be near an airport that would take me around the country to hospital sleep centers, which was difficult to do out of Wausau, Wisconsin.
Okay, so you had a problem, and it sounds like you had some kind of sleeping disorder, or what you probably know better than me. So why don't you tell us actually what that problem was?
Well, I was a mouth breather that would snore very loudly and disrupt my spouse. And my spouse, being a registered nurse, kept telling me that I'd stop breathing at night. And of course, most of us males can't handle the truth when it's told like that. So after one time having represented people in automobile accidents where drivers fell asleep at the wheel during the day, learning about their sleep issues, I after those depositions, I went home and told my wife to schedule a sleep study for me. So I had a sleep study done at the hospital, and wouldn't you know, I stopped breathing 22 times an hour.
You know, I've been told that I should take that test also. I don't know, Dale. I used to have no issues, but then my wife said, you know, you're starting to snore very loud. And I don't know, Dale, I might be in competition with you there, but I don't know. I don't hear a thing.
I know.
All right, so we're in the same boat here. I'm still kind of jammed up and snoring at night, and I know other people that do. I know my brother's a very loud snorer because my sister-in-law actually put him on the phone when he was sleeping, and I couldn't believe it. So I don't know who wins, but so it seems like a lot of people have this issue with snoring, but also there's more to it than just the snoring, right? It's about the mouth and being able to breathe correctly.
That's correct. The key element that was the problem for me was the mouth breathing. That created the loud snoring. Most people, if they have their mouth closed when they're sleeping, they may have a little purr, but it's not like, really loud. Me, I open my mouth and inhale, and that's how I sound. I mean, close my mouth, no sound.
Wow. So people might not realize this. So you did, and you came up with chin-up strips. So let's take a look and show the audience what you came up with to start with, and then we're going to find out a little bit more about your journey of how it actually came to fruition. So let's take a look at what you have there, Dale.
Okay, I have the chin-up strip. This is a 3M medical grade tape that's die cut into the shape of a U. This one is used primarily by the males that use the chin-up strip. And once we got that developed, I had another sleep study with a chin-up strip on, and lo and behold, my sleep apnea was pretty much reduced. Um, and then we had to go to the next step once we discovered that. And the doctor that realized it after I did a sleep study with a chin-up strip on, he said, uh, Attorney Miller, you better get this patented. Millions of people will want this.
Hmm.
Oh, I did.
So Dale, show us. You showed us kind of a sticker of a U on an adhesive there. So how do you? What do you do?
Let, let me just show you how to put it on. It's really
Yeah.
simple. It just touch the top lip, pull it down, say up. There it is. I fall asleep, my bottom lip stays right up by my upper lip. It's all
Wow.
mouth breathing is done here.
So what you're
That's right.
doing, okay. My wife might want to put it over my mouth. So hopefully, hopefully I get to the chin-up strip first before her. But
I
what
know.
you're doing is you're actually kind of forcing in a way, or you're positioning your mouth in a way to remain closed
That's correct.
to breathe through your nose.
And the key thing is that we're not jamming the teeth together, which we found people that use CPAP and then they use a chin strap. That chin strap jammed the teeth together. And I had that for a while too, but that would, my jaw muscle would fight that. And so I had to come up with something because I knew the CPAP machine really helped me feel better, have more energy, and I didn't snore. And my wife was very happy about that.
Tell us, because not everybody might know what the CPAP machine is or what that is. Can you just give us a quick explanation?
That's the machine that um, blows air into your nose at night and make sure that your airway stays open. It's a constant pressure, and now they have machines that adjust the pressure as needed. And of course, people that continue to mouth breathe with the CPAP would often quit because the air went in the nose and out the mouth, and then their mouth would have they'd be dry mouth. It'd be terrible. And we had studies that we saw where 60% of the people prescribed CPAP in 6 months to a year, the CPAP's in the closet if they're a mouth breather. So they have no treatment then for the condition, which is very dangerous in terms of dying in your sleep. I mean,
Oh,
it's okay to die in your sleep at 95, but not at 45, like a number of people have, unfortunately.
yeah, it is definitely something to think about. So, Dale, I just want to let the audience know. I mean, we took a look at what the device is, as you call it, a device. But to date, how many units have you sold?
Well over 10 million. It's
10
probably closer to
million.
12 million by now. Yes.
Wow. I think we should have started off with that, because that, for the audience listening or watching, that is very impressive. Can you imagine 12 million units? So, Dale, you're obviously successful with this. Congratulations. You have Chin-Up Strip Company. You're selling chinupstrips.com, people buying it. Tell us now, you started to figure out, you knew this was a problem, and now you wanted to come up with the solution. So when you wanted to kind of position the mouth and or the chin to be in that position, tell us how you kind of went through figuring out what the solution would be.
Well, we tried different types of tape. We tried taping the mouth shut. Well, that didn't work very well because if you coughed at night, you would back blast whatever the air into your lungs, and then that would wake you up. Well, that didn't help the problem at all. I mean, the sleep apnea was waking me up, and certainly we couldn't have a device that would wake us up. So we had to develop something that would allow the upper lip to be free. So when we would cough with a chin-up strip on, the air would just naturally come out the upper lip and not disturb your sleep.
So you were trying to find the right position for the strip to be adhered to the face, to be able to allow you to still be able to have kind of a pathway through your mouth, but mostly through your nose.
Yes.
Okay.
And then our goal is to enhance primary nasal breathing, which is, if you've ever read the recent book by Dan Hester about breath, which I always recommend, it really is primarily the one thing in life that keeps you healthy and live longer is breathe primarily through your nose when you're awake and especially when you're asleep.
Dale, show us the demo of the product again, because after I just said 12 million uh, units sold, I'm sure people are going to want to take a closer look.
Well, I'll show you a different kind. This is a different shape. This is the one for the females that tend to prefer this because the cheek tabs are further away from the tender skin up by the nose. So I use this one too very often, but this one is a little more comfortable for the ladies that want to have the cheek tabs further out on the cheek. So that, there again, we'll stop talking and.
Mm. Well, stop talking and breathing through your nose.
Mhm.
Now, what's to stop somebody from taking a piece of duct tape and putting that on their face? What makes yours so unique? And also, if you could just touch on the intellectual property, your patents that you may have.
Well, it's medical grade adhesive tape manufactured by 3M. So it has to have the right kind of adhesive to prevent skin irritation. That's the main item that we had to deal with. And obviously duct tape or any other tape that isn't uh, hypoallergenic and uh, having the right amount of adhesive that will allow a good release, but yet keep it on during sleep was the key factor we had to find. And the people that helped us actually were the Breathe Right people. Dr. Dan Cohen in Minneapolis was very much involved in helping us get to 3M because their product, the Breathe Right strip, was a comparable product to the Chin-Up strip. And the combination, of course, we had sleep studies done with the combination, and that the results of those studies ended up allowing us to get this FDA cleared in 2004.
So you've been selling it for some time now, and you've been working on this for a long time. When you figured out the shape that it needed to be, what kind of experience did you have actually going into manufacturing? Because it sounds, you mentioned that you were an attorney. I see that you have JD in your title. Did you think that you were going to be an inventor at this point?
No, no, but growing up on a farm in Wisconsin, we're always inventing something to make work easier. So I had that in the back of my mind.
Uh,
There's, look at things, and I always look at them like there could be a better way.
I'm
And
inside your lens. I was recently in Nisita, so
okay,
I definitely saw some farms passing through for sure.
yes.
So Dale, you're looking good here, getting to that point when you're working with the other doctor, the Breathe Right nasal strip. What about the intellectual property protection? What did you do with figuring out how to protect an adhesive strip in a certain shape?
Well, fortunately, I had a friend from law school who was a patent attorney in Milwaukee, and he had graduated from Marquette, and I had graduated a couple years ahead of him, and uh, I knew his family in Wausau, so he was a patent attorney in Milwaukee, and just contacted him and let him take it from there. He was able to do the drawings, and of course, it was important, I thought, to have a patent attorney because the whole patent process moved right along then. He told me, if you don't have a patent attorney, the application sits on the desk of the examiner and with their 2, 3 feet high. But if I'm calling the examiner on a number of patents, I'm always asking about your patent. And he was right. It really went through in a very short period of time. And they come up with the design, the attorney does, and then they determine the claims to be made. So for me, knowing that it was important and also knowing someone that was a patent attorney, that was very helpful.
You got to a point here where it seems like you're just breezing through. You had the problem, you figured out where to go to get on path. You had protection here, and you had a good in with a patent attorney helping you kind of through all the steps there to that point. What sort of challenges did you have, Dale? Or is it a little bit further in when you started to work on your manufacturing, or was that pretty clear also on the path?
Yes, the challenges came more when we started to work on the marketing. That was the challenge. How are we going to market this product? And fortunately, This was in 1995, 96, 97. Guess what was getting to be real popular? The
The
internet.
internet, yes.
Without the internet, we probably would never have made this go this far. But so in like 98, we started, with a website on the internet. And it was interesting that the first note I received after someone saw the product on the internet was, "This is the dumbest invention I've ever seen." I should have kept his name because I would be
12 million units
pleased.
later.
Please to
Right.
let them know how many we've really sold. And quickly, practicing law is a great life, very stressful, and I enjoyed that for like 29 years. But the satisfaction I get now when I talk to customers about how I've really helped them sleep, get good quality sleep, is more rewarding than the practice of law ever was.
It's true, Dale. I'm up to 15 issued patents, and the products that I end up bringing to market, when people use them for the same reason I came up with them, that that's the gold to me.
That's
That is the
wonderful. I
feeling.
mean, yes, right.
Absolutely. But let's just go back now. Finding a manufacturer, you knew that you wanted to use 3M tape, but to make it into the shape with the dies and then figuring out how you're going to manufacture it. It sounds like also you had to work on packaging and you figured out some of the marketing, but tell us the experience going through, because you being an attorney, now all of a sudden you're turning into a manufacturer. What did you do then?
Dr. Cohen was there, and he was working with a company in Minneapolis. And after he recommended the 3M tape, he said, "This is the company that makes the breathe right strips for us. So why don't you go there and have them come up with a die and get it done?" So it's really important, as you can tell, to have a contact at these different levels, somebody that's been there that can help you along. So, and don't be afraid to ask people that you know that have been involved in developing products. It's important that they can give you information and where to go.
Tell us about the experience of naming the product, because I feel like when you come up with an idea and you name it, it's like you're naming your baby, right? So tell us some of the iterations or the experience that you had, and who else has been involved with you coming up with these decisions that you're making along the way.
Well, my wife was so happy that my chin was up when I was sleeping and not snoring that that gave me the idea that we should simply call this a chin-up strip. I mean, keep it simple. And when you say chin-up strip, generally people go, "What is that?" And so that you get to answer that question instead of having a more complicated name. We just kept it at that, and that's really how it developed as terms of naming the product.
Getting through now all the steps that you needed to get to a point of starting to sell it. What was the experience like getting the product made and having inventory? What all of a sudden you, okay, let's turn on the switch, let's make some of these things, and what happened then?
Well, of course, people started buying them off of the internet. Once it started rolling, I was being asked to speak at sleep support groups around the country. I knew I had something going then when the doctors were calling and the sleep support leaders were calling to have me come in and talk about an alternative that would help people be comfortable with their CPAP, an alternative to that chin strap that went around the head and under the chin. Um, so that was the key thing, is to develop that marketing and have people invite me to speak to groups that were having issues with their CPAP and with snoring. Um, and I traveled around the country for a number of years, including Stanford, where the sleep apnea development was originated by Dr. Dement. And that was really what kicked it off. I mean, and then finding some investors that would put some money into the pot, and real quick, I was down in Atlanta, moved down here because we had to be near an airport that would where I could travel around the country without having to hop, skip, and jump from Wausau. And so, don't you know, I happened to get 4 Masters tickets. And then one of my friends up in Wisconsin was a golfer and owned a golf course. So I invited him, and he said, "Can I invite my friend along?" I said, "Sure." He said he just sold his company in California for $90 million. So, so I took him to the Masters.
Why not?
And, and I thought, well, maybe he'll, you know, give me a little donation. And he had loved being at the Masters. I mean, people from Wisconsin, they get to go to the Masters. That's exciting. And so I got back in the car after the match was over that day, and he said, "Dale, I'll give you 300,000 to go into your company, and I only want 25% of your company. You got to run this thing." And I go, "Now I have to drive 50 miles and not goof up here, because this is unbelievable." I thought maybe 25,000 or something like that, but that really kicked it off. I mean, once we
Great.
got that kind of money,
Congratulations. You really, I've had shows where people have really gone through trials and tribulations to get to where they are or where they're going. And it seems like you just kept hitting it right on to be able to get to a point of success of 12 million units later. They'll show us the product again and show us how people can actually purchase it. In
okay?
Is it in a set? I put one of these on each night.
Yes. And let me show you our number 3 of our 3 different types. This is a white polyester, non-woven polyester. And there again, just goes on like that. And the polyester has a little more aggressive adhesive. So people that have very oily skin, or if they have short facial hair, they can use this white strip that is non-woven polyester, soft. I use this often if I haven't shaved for a few days. This is the one that I use, and it's very comfortable. And we recommend to use warm water to remove it because it's a little more aggressive.
Okay.
And the other strips you just kind of peel off, just like you would peel off a Band-Aid.
And how are they sold, Dell? They're in a package
In
of
30 packs, they're sold in 30 packs like this with all the instructions. And in the pack, you get 30 at a time. And this is called the horseshoe shape. This is called the boomerang shape, if I get it on right, the
yeah.
boomerang. And as I said, the horseshoe one, tan horseshoe, is preferred by the males, and the boomerang tan is preferred by the females, and the white one's preferred by people with oily skin or
Or
a
beards.
mustache or a short goatee beards.
And where can we purchase them? Are they
Chin-Up,
strictly online?
chinupstrip.com. They're available on Amazon. And MVAP Medical Supply, or what's called Patient Sleep Supplies, in Thousand Oaks, California, is our major distributor. And so that's a place where you can buy those. We ship a lot of chin-up strips to California and to New York. Of
Thanks
course,
a
we
lot.
have high populations, but that's where you can get them. We tried getting into the stores, but that just didn't work out. I mean, they just want so much money for advertising, and the risk is you can put them in the stores, and if they don't sell, you have to take all the product back. And now you have all that excessive inventory that you had to cover the cost of. And so we stayed with the internet. That has worked out well.
There are inventors, entrepreneurs, startups, people that love just listening to somebody like yourself that came up with an idea and bringing it out to market like this. What are some words of wisdom, Dale, that you can share to the people out there on their potential future of bringing an idea to market?
Well, if you have an idea, work on it. Never give up on it. But the first thing you have to do is go online and find out at the patent department if anybody else has the idea. And that's, you can do your own patent search online. And if you think you have something that isn't covered, then simply go to a patent attorney and have them do a final check on the patent search, because that's what you really need to protect the idea. And from there, it's just get it made, get it put together. And if it's a medical product, then you'd have to deal with the FDA and get them to review it, and which really helped our sales and verified the product.
Well, got to keep getting the word out and keep selling more chin-up strips out there like you've been doing. 12 million and still going. Dale, congratulations on your success. And one thing that I learned and that other people will hear from you is that your connections really helped you to bring your idea forward, for sure. It was who you knew.
Reach out to people, they will help you.
Sounds great. Dale, congratulations on your success so far. I know it's been how many years?
Wow, what, 20 some years?
20 something years.
I'll be turning 80 years old on February 3rd, and I really am feeling healthy and well because I was able to get quality sleep and stop the mouth breathing, and I owe that health development and comfortable life to the Chin-Up Strip.
I will be your next customer, Dale. I appreciate your invention. I appreciate you. Thank you so much, Dale Miller, Chin-Up Strip Company. His website is chinupstrips.com. You can go there and you can check out more about Dale and purchase his product. Thank you,
And
Dale.
if you go online, Brian, you can order a sample pack, free sample pack.
Oh,
and
I will.
And just to try it, and we send out all three, two of all three of our strips to get them to try them. So
Excellent.
That's an
Thank
easy
you
way
so
to
much.
find out.
Thank you, Dale. Thank you again, and we will keep in touch. Great
Thank
job.
you, Brian.
Thank you. Okay, that was a great interview with Dale Miller from Chin-Up Strips Company. And if you would like to be a guest on the Got Invention Show, go to gotinventionshow.com. We love hearing about the journeys of everyday inventors. Thank you so much. And until next time, keep on making your dreams a reality, just like Dale. Thank you, and see you soon.